So we looked at the drugs trade, human trafficking and CSE. So firstly, child sexual exploitation. Although awareness and reporting of CSE has gone up, prosecutions have not. And this is due to the complexity of the crime, lack of shared understanding of CSE, contradictory evidence, prosecution process viewed as a challenge, and not always in the best interest of the children, who are more likely to be re-traumatized by the experience of giving evidence in court. Other challenges relate to minimizing the harm to the victims, whilst safeguarding, educating and counselling young child sex offenders who are sent sexualized images of themselves. In the snapshots, we found the prevalence of self-generated indecent images, SGII, although I'm not going to refer to them as that, is increasing. 22% of teen girls and 18% of teen boys have sent nude or semi-nude images. That's a fifth of our young people in their teenage years have sent sexualized images, which are pretty much by definition illegal. The prevalence, so as of December 2019, 6,000 children have been investigated for indecent images of children offences in the past 3 years. The boredom posed by the restrictions, lack of physical peer interaction and ease of internet access has led to an increase in self-generated imagery being circulated online. There has also been an increase of children signing up for pornographic subscription services such as OnlyFans since the pandemic. Self-generated images are traditionally thought to be the result of coercion or grooming. However, this is increasingly being shown to be a conscious choice by young people to engage in this behaviour. This is not the last time we will see the blurring of lines of who are the victims and who the criminal justice system sees as offenders. Also, how legislation aimed at protecting young people from harm is drafted, interpreted and prosecuted to the harm of some young people. Dr. Kosaraju, and by the way, that's the only reference to anybody, but in all of the papers, you will see the really talented people that spoke to us. But I don't want to waste my time now just saying thank you to them, or other than to say, clearly we couldn't have done it without them, and thank goodness they're actually conducting that future research. But anyway, Dr. Kosaraju's research into the prosecution of CSE offences identified 6 key improvements, and they included the same officer to work throughout the case, integrating missing person investigations within the CSE investigations, and ensuring children are not criminalised or punished for their abuse. Moving on to the drug trade and migration. So tramadol, a painkiller available on prescription, is perceived as a new drug of abuse, especially in Nigeria, where it is today the second most widely used drug after cannabis. In response, higher dosages of the drug have been prohibited and its importation curtailed. Similarly, in Niger in 2015, they introduced a new law prohibiting the trans-Saharan transportation of migrants. These 2 state interventions have made the legal and social status of formerly illicit activities more ambiguous. The new policies have ignored the blurred lines between accepted medical use and recreational abuse of tramadol, and also conflated migration with human smuggling and trafficking. Criminalisation has led to serious harms. For example, the restrictions on tramadol have led to more difficult access to cheap painkillers and the emergence of a black market in potentially less reliable drugs. In the case of the transport of migrants, the journeys chosen by transporters and migrants have become more dangerous, leading to more deaths in the Sahara and higher costs due to the greater risk of arrest. Current dominant narratives ignore the government's role in creating the push and pull factors underlying drug use and migration, such as the lack of affordable medical facilities, leading to self-medication and the scarcity of local job opportunities. The lack of affordable medications in African countries brings on an additional challenge, that is counterfeiting, especially with drugs coming from Southeast Asia. In the UK, there's an increasing issue with the legal use of medicinal cannabis. From a practical policing point of view, there is confusion between legitimate medicinal use supported by a prescription and doctors suggesting the use of cannabis as a painkiller, but without a prescription. Our roundtable discussions came to the findings and recommendations to acknowledge the embeddedness of the tramadol trade and the transport of migrants, and that they cannot be changed easily, especially as livelihoods depend on them. Recognise that criminalisation of tramadol and other drugs leads to serious harms, especially to the rights of drug users and migrants. We need to look beyond single factor explanations and better address the context driving these activities, such as underfunded healthcare, the need for pain relief, or the lack of job opportunities. Policy also needs to be inclusive, with strong input from civil society, victims, and those currently criminalised. On day 2, in the snapshot sessions, we heard that a recent United Nations Office on Drugs and Crime report on 148 countries identified different issues associated with human trafficking and migrant smuggling, including deterioration of labour rights, work exploitation, and domestic servitude in industries such as agriculture, fishing, fashion, and transport of consumer goods. Not policing, even though some of my former employees alleged that I might have been engaged in some sort of abuse as an unreconstructed boss. Nonetheless, the primary concern remains sexual exploitation of women and girls, and the lack of gender-informed interventions in countries that place little consideration on women's rights. In the snapshot sessions on day 2, we heard that among the Salvation Army's current lines of research, they are looking at a pilot to support repatriation and reintegration in victims' home countries, anti-trafficking responses during COVID-19, and survivors' access to care and counselling and access to independent housing options. And we've also heard in the national press, haven't we, about the asylum seekers wishing to gain the right to be able to work. We also discussed a more UK-focused exploration of the drugs trade with a specific look at county lines. In recent years, county lines have become sophisticated and professional business models, and experienced dealers first test the market, then progressively form hubs for transportation in different small areas. The arrival of a county line in the host town creates friction with local drug dealers and gangs and increases serious violence. County lines have caused disequilibrium in the user communities, who are now employed as user dealers. Nonetheless, user dealers themselves have also started to take advantage of these new opportunities, making extra cash on the side, cutting drugs, trading intelligence with others, including the police, to climb the hierarchy ladder. This new model puts other users at risk of exploitation and criminalisation. Young people and people from disenfranchised communities are both victims and offenders, often within minutes, and more likely to be cuckooed. Albeit vulnerable, they often think they are in control of what is happening. It was recognised that a public health approach is needed to tackle drug misuse. Whilst extremely successful, the Scottish model may not be applicable in England, and a bespoke model which considers social and localised issues in England is needed. The recent model of violent reduction partnerships cannot ignore the impact of county lines and the fallout from policing the drugs trade. In the West Midlands, the increase in youth violence is linked to poverty, economic and social deprivation, and hunger, but also a lack of trust in the education system, social services, and the police, who have let down people in the past. Sexual harassment has been identified as a precursor for violence in the context of domestic violence. There is a need for trauma-informed responses and a public health approach that employs culturally competent youth workers to provide knowledge of alternative paths to young people at risk of gang crime. Other general barriers identified were lack of financial investment and short-termism amongst stakeholders involved in violence reduction partnerships. Probably refers, Craig, to your 12 months pay, 8 months effort. The Scottish Government SOC strategy is framed by 4 strategic principles: divert, deter, detect and disrupt. Research recommends the addition of a 5th D, develop, premised on community development as a means of responding to the harms associated with organised crime. Currently, there are few opportunities for young people, so they get enchanted with the idea of quick money fast. The addition of this 5th D would ensure the creation of local opportunities for young people to achieve their goals pro-socially. We heard that for research to have an impact upon professional practice, there needs to be access to data. And I think that's the partnership that we've just, the question about partnerships we've just seen. It is of great concern that the principal repository for organised and serious crime data, information and intelligence, is the Police National Database, the PND, which is also open to and used by non-police organisations such as the GAIN network. The Home Office has no plan for its curation and development and has refused to invest in PND since 2017 because it stated that its now discredited NLEDS programme would replace PND in 2019. That date was put back to 2025. And we heard at the Public Accounts Committee 2 weeks ago from the Permanent Secretary that they have no plans prior to 2031 to replace the PND, which is in desperate need of investment because the Home Office neglect since 2017. So not only do we need access to data, but the 3 key values of those academic partnerships that have been found to underpin research informed impact, and they were collaboration, understanding and respect. And I know they may sound wishy-washy, but if you haven't got those, then what the researchers have found across a band of research, it has no impact. Partnerships are very important as opposed to competition between different agencies. Nonetheless, some practitioners express concern that local partnerships lack national direction and strategic input from the government. Ironically, there's also concern that too much government involvement can break down efficacy within local partnerships, which can become an extension of the government. Modern slavery is a slippery and mobile problem in nature, and those involved in responding to it should be able to be mobile too. As an example, a worker who can effectively connect with a Roma young person in Kent should be able to support another Roma young person in Leeds, and this again points to the need for access to national systems. Concern has also been identified around the quality of staff working with survivors of sexual exploitation and modern slavery. Inadequate training of support workers can result in safeguarding concerns not being reported. The psychological needs of victims need to be properly assessed by mental health professionals and survivors of human trafficking. And survivors of human trafficking not being referred to effective rehabilitation programs. An integrated approach to care for survivors is likely to be more effective, and survivors who have gone through their rehabilitation journey should be consulted about the feasibility and validity of rehabilitation programs and be recruited onto research teams investigating the impact of such programs. The need for a multi-partner approach is augmented by the following points to emerge from one of our snapshot sessions, which focus particularly on Brexit. During the Brexit referendum campaign, the media raised the alarm on the ease with which EU nationals cross borders and commit crimes on British soil under the EU's freedom of movement. Brexit has exacerbated the serious organised threats. For example, the new points-based immigration system can lead to the rise of human smuggling, human trafficking and labour exploitation due to the squeeze on the labour market. A current systematic review is underway to examine the impact of Brexit on serious and organised crime in the UK, as well as the impact on the operational capacity of law enforcement, for example, the loss of the Schengen Information System, SIS2, and its impacts. A criminogenic profile of Brexit will be developed to inform policymakers about possible alternative developments of organised crime in the UK. And finally, you'll be pleased to hear, there is an over-reliance on individualistic models of behaviour change, which sees injecting drug users, or indeed victims of human trafficking or CSE, as rational decision makers. However, External factors are often ignored. But in relation to the drugs trade, to address cuckooing, we need a multi-agency progressive approach that starts recognising the failures of the UK's drug policy and tackles poverty and deprivation. Decriminalisation of drug possession offences can address cuckooing, perhaps adopting the Portuguese model. Personally, by the way, I don't agree with the words like decriminalisation and legalisation and things like that. I just say it's just a change in the way we regulate drugs, because alcohol is regulated, it's not legal. Tobacco is regulated, it's not legal. Heroin is not illegal, it's regulated. And should I be dying of cancer in a care home, I do actually want them to put diamorphine in my bloodstream. So we probably need to, just as in all these things, agree on more accurate definitions of what we're talking about. And finally, we should also consider restorative justice alongside criminal interventions within the context of serious and organised crime. It can act as a deterrent for young people on the verge of committing offences, as well as reducing the reoffending of those seemingly locked in the cycle of crime. And those are the votes from the Northern jury, Chair.